this YouTube stuff, I would need to make it better, but it's just for this class. It's just an effective means for me to engage you people here so that I wouldn't have to ask any of you to put off your speaker or this. If you have anything to talk as your background, maybe you're not listening, it's okay. You can just for righteousness sake. But if you are here for the purpose of this class, you would listen and then the background sound will not disturb any of us. So we just have our typing these fingers to work for us or do the work for us. Also, my sincere apology based on this because as it stands now, my you'll be hearing some sound transmission from the background, but I'm very sure it would not disturb our communication as you would hear what I need to say and the sound would not make you not to hear rather. The reason for this background sound is my system BIOS. I've actually gone to try to fix it, but I couldn't get the one that match my system since it's new generation. So probably if my repairer, my maintenance expert have it, if anytime we have a class like this, that it happened the other time, you won't hear this sound. It's not too good for us. Meanwhile, looking at the screen, I'm sure you can see what we have. We are looking at the muscular system. All right. I hope you can see it. Hello. Type on this comment section if you can see it changing. All right. So right now we let me start. I hope you can see the screen changing. When I move to slides, you can see it, right? Let me get a response from you, then we kickstart. All right. Without response, I would just go ahead. Hello, can you guys hear me? You can hear me very well. Okay. So we would move on. But if at any point in time you cannot hear me, my I may not see it once I put it in slideshow just like this to cover the whole of my screen. So but I'll be coming from time to time, all right, to see the complaints you have on the chat section because the chat section may be a bit um off my site for now. All right. So this is it, the muscular system. All right. Um, if in the comment in one of the description, if you look at for this lecture, it's aimed to describe the to describe some of the basic anatomy that is applied to this system and perhaps the region, all right, briefly, and That will in turn enhance what communication amongst you and other allied health sciences. All right, the nursing, the and if you actually go back and maybe if you're looking at your book and then you hear something about the muscular system, you be familiar with it. Or the region like the axilla, you also be familiar with it. It won't look strange to you. So this is our objective, okay? That the students know what the basic anatomy of the muscle and have knowledge regarding what classification or nomenclature of skeletal muscles. Then also you would get the knowledge, basic knowledge that is pertaining to the muscle function. But for the purpose of this class, we would not uh, I will not focus emphasize on the histology. In fact, my emphasis basically is just the gross structures, okay? It's just the gross structures that we'll be looking at. And for the histology, I know that you would do the uh, you would have a lecture on histology of the muscle. And then when we have a lecture on the histology of the muscle, by then I know that you would at least have those information that is very valid for the histology of the muscle. But so this is particularly the gross aspect of it. All right. Now you can see the slide. It's not strange that you have about how many muscles? 600 individual muscles. All right. And very interesting. Um, every movement that is produced in the body is owned specifically to what muscle. And then we'll also talk about this in our histology section. Okay, so when muscle contracts and relax, it will lead to what? It will enable movement of the guts, gastric. Like for smooth muscle, it will enable proportion of food. That it will lead to what is called segmentation, bolus formation, segmentation, propulsion. Okay, and you can see it in every other muscle, like when the a muscular artery um contract, they will also play a role in terms of in moving this blood. Okay, like for the cardiac muscle also, the cardiac myocyte have to contract to enable what effective pumping of blood. Then if you come to skeletal muscle will aim to do what? To move to move the skeleton across joint and to maintain posture. All right. So these are the things you would really need to know about the importance of muscles. Okay. Then there are this, you can see the three basic types of muscles. We have the skeletal muscles and so on and so forth, the cardiac and smooth muscles. But I think most of our lecture will basically emphasize more on the skeletal muscle. Okay, maybe we can talk a bit further in the histology of the skeletal muscle, cardiac muscle, and smooth muscle in the histology class. Here you can see a description of the uh, muscles around the face and neck, and their labeling are also shown. They are well done correctly, and most of these things you can see the muscles of facial expressions. We have the occipitofrontalis. Okay, we call it occipitofrontalis because they function as a unit. We have the occipitalis, you have the frontalis. They are joined by aponeurosis, which is also called the epicranial aponeurosis. Aponeurosis is one of the layers. Okay, one of the layers of the scalp. All right, it's one of the layers of the scalp, and is just lying immediately above the layer of loose connective tissues. So that's just it. Other muscles you can see the temporalis. I'm sure you can see the pointer. Let me put the pointer. Other muscles you can see uh, other muscles you can see apart from this is what the temporalis. Okay, and you can actually appreciate this, the masseter and the buccinator. This buccinator is very, very prominent in infant, okay, and children. All right. Okay. So we can move. This is the sternocleidomastoid. The muscle take origin from the from the superior surface of the what a clavicle. All right, and the uh, uh, the sternum, okay, and the suprasternal notch, which I mentioned the other time, and then it will insert in the, that is the proximal or the distal attachment will be at what, the mastoid process of what, the um, the temporal bone, okay, okay, mastoid process, all right. So that's that. This is also showing you some muscles of the trunk, okay. You can see on the, the trunk we can divide into the trunk is divided into three parts: the thorax region, the abdominal region, and the pelvic region. And apart from, just the only place where you have a clear demarcation in these regions is the between the thorax and the abdominal region. All right. But between the pelvic region and then the abdominal region, the cavity rather to say, rather I mean the cavity is on that region. It's not, no clear boundaries. All right. So, but for the muscles, the thoracic region, you see muscles of the ribs, okay, the intercostal muscles, which are external intercostal, internal, and we have the middle. There's external intercostal, internal intercostal, and innermost intercostal muscles. All right, and then you also have the subcostal muscles. All right, and here you can see clearly, okay, the muscles that covers the ribs, six ribs. From the first to sixth ribs, there are two muscles here. This is the pectoralis. Beneath it, you have the pectoralis minor, while this in front of it is the major, and so on and so forth. For the limb, for the upper extremity, you can see some of the muscles that are listed there. And then for the abdomen, okay, we can definitely appreciate some of these muscles, and some basic features like the um, here they have removed what, the external oblique. I mean, look at it here, the external oblique. All right, and then you have the internal oblique. All right, and then you also have the uh, transversus abdominis. You can see the way the orientation of the muscle fibers. For the external oblique, you can actually describe it like a hand in the pocket, while the internal oblique, you can describe it like the orientation of the fiber, like a hand placed on the chest. Is that's just like that. Just simple way for you to see this thing and be able to remember the direction of the fibers. Okay, and the transversus abdominis, just as the name implies, is the fibers appear transverse. Okay, I wouldn't bother you about their origin and insertion so much, except where it's necessary. I will mention it. All right, and beautifully where you can see this, the rectus femoris, I mean rectus abdominis. That means eggs where you have the rectus in the body. Okay, eggs where you have rectus, like for the femur, it's called the rectus femoris. Rectus refers to, or means what, straight. Okay, it means straight, and so you can see how straight this rectus abdominis is. In between this rectus abdominis, you see the tendinous insertion. Okay, so that once this muscle hypertrophy as seen um, in what do we call these people? These muscle builders, okay, that try to work on their abs. This muscle hypertrophy and this tendinous insertion doesn't go behind, just in front. So you try to what, limit the spread of this muscle upon hypertrophy. So it will give rise to this bulkiness in section, as seen in these people who try to build the abs and have six packs, and so on and so forth. There are deep muscles. The ones we just looked at was the anterior, and now we look here is the posterior They have both the superficial and deep muscle. This muscle actually functions basically in the upper extremities. All right. I just hope I am not too fast. I'm concerned about time too. All right. So this is the latissimus dorsi, which you can see. All right. And these other ones that have been labeled. All right. They've been labeled there. And you can actually appreciate again from this angle, you can see the sternocleidomastoid. All right. It's one of the important muscles that help us to what? Make a clear demarcation between the anterior and posterior triangles of the neck. All right. But the our lecture will not be looking at that for now. All right. And also, let's go back to this slide. You can see also a space, all right, posterior to the axilla. Eh? You can see two spaces. We may describe this space. You have the quadrangular space here, and then you have the lower triangular space or triangular interval. And this is the medial upper triangular space. All right. And see the muscles you can see. You have the long head of triceps, all right, and then you have the teres major muscle. Here you have what? The teres minor muscle, okay, and then the long head of tricep crossing between, all right, and you have the bone here. But let's see if I will talk about that in this lecture. Then I believe that when we get to that place, you would definitely appreciate it as we have been able to highlight it here. All right. Let me put this and mark it for you to see. All right. Look at it here. This space we are talking about. Look at the space here. So there are three spaces that are seen. All right. So let's move on. Let's move on. Okay. Yeah, we'll talk briefly about the upper extremities, and yeah, this is the lower extremities, and we can also see some of the muscles as well. You have the rectus femoris, which I mentioned earlier, all right, and then you have the sartorius. This is the longest muscle in the body. Its fibers can range up to as long as how many meters? 1 meter. So, all right. So that's this. Other muscles you have is the vastus. That's the quadriceps femoris, which are the vasti muscles. Okay, together with the rectus femoris that make it up. Others are the adductor magnus, that's the adductor group of muscles. You have the adductor magnus, you have the adductor longus and brevis, okay, and so on and so forth. Other muscles like the iliacus and the psoas muscles, they are just there. And please, let me just take a little look at the comment section. Let me see if you can hear me as this lecture is going. Please let me indicate on the comment section right now so I can proceed. All right. Are you following up? This is a panoramic view, and all the things have been shown. They take both in section, the superficial and deep, okay, where necessary. And let's see, this is the back, all right, or the posterior. All right, and then you can see the gluteal muscles. I think we'll have a lecture on the gluteal region. I don't know if time will permit us to go ahead. All right, this is the gluteus maximus and then the gluteus minimus. All right, I mean medius. They also have the gluteus minimus, okay, which is underneath this. All right, so we'll look at them, and then these are the muscles of the um, these are the muscles of the forearm, but this what is shown here is the extensor compartment. Anteriorly we have the sorry, what you see here is the flexor compartment, okay, and then no, what we are seeing here, this is the cubital fossa now. No, this is the elbow joint, okay? This is the elbow joint. So you are seeing muscles on the extensor compartment, apart from this flexor carpi ulnaris, which run on the medial border of the ulnar aspect of the forearm bone. That's the ulnar. All right. The rest you can see, you have the extensor carpi ulnaris as well. Eh? You also have the extensor digitorum, which you are seeing here. All right. And then to the leg, you have the calf muscles, okay? These are the calf muscles, the gastrocnemius. and what the soleus make up the calf muscles. And this is just showing you a description of how muscle produce movement, skeletal muscles produce movement. Upon contraction, this is describing that this muscle is in a relaxed state. All right. And then when this muscle contracts, it will lead to what? A change in the geometry of this muscle. Eh? And once the geometry of this muscle change, you see like this one are contracted, it's got shortened. And if this happen across joint, it will lead to movements of the bones between the joints. So if it happen between the forearm and the arm, the muscle that crosses that joint, it will lead, it produce flexion or extension. All right. So this is a relaxed state. This is a contracted state. And beautifully well, some of these muscles have been shown. This one looks more like biceps. All right. This looks like bicep. We have the long head and then the short head. This will be coming from the tip of the coracoid process, while this will take its origin from the supraglenoid tubercle of the what scapula, and then at somewhere in the arm they will unite to form a common fleshy body that attach to it, that give result in a common tendon, just one tendon that will insert on the um ulna, radial side of the ulna. All right. Then you have the triceps. Okay, this and this one is just a clear illustration of the tricep. All right. Why this is looking at the basically the quadriceps femoris. You have the vastus medialis, vastus lateralis, and then rectus femoris. Okay, the rectus femoris. Okay, sorry, the vastus intermedius. In this case, the rectus femoris have been removed. So you are seeing the vastus, but what you are saying is the okay. Okay, what you are seeing is the vasti. And then here you have your triceps, the long head, the medial head, and then the lateral head. And you see them insert. All right. This, just like we said earlier, is the external oblique. Eh? This is what? The external oblique. See the orbicularis, oblique, all right, and so on and so forth. I believe we would see this muscle as we move further and we'll be able to name them. All right. But here is just going a bit into the histology and we would not be looking at it. All right. We would not place emphasis on it for this purpose of this lecture. All right. And then let's look at, okay, all these two are basically the histology. If I send this note to you guys, please don't bother about this for purpose of this lecture. But for the histology, we'll look at it. Now, when we look at the classification of muscles, okay, um, in this case, we say, first of all, if I go back to the beginning of this, we're able to say the types of muscle is not the same as classification of muscle. All right, it's not the same. They are completely different. So don't get confused. So if you see it in essay question, or we don't know, if you see it also in an MCQ question, you should be able to understand or answer the question appropriately well. This is just basically the classification of what? Muscles. And we can classify the muscles based on their orientation of the fiber, or that is called the fascicular orientation. And we can also classify based on the um, we can also classify based on what? The type of the skeletal muscle fibers, okay? And then the third classification is by their insertion, either near or far away from joints, okay? And the next would be a nomenclature, that's naming. But let us now look at this classification. If we go by fascicular orientation, we have these four. We have these four, all right? Don't get it confused. Just know for vascular orientation, it can either be parallel, pennate, or spiral. It can also be cruciate, just like as it's seen here. All right. This is, I think this is an example. All right. Cruciate is like a cross. Let me see if we have a good example. We'll see it. I don't. That's not. So, anyways, let me move on. For the parallel, you see the muscle fibers are arranged in there's their by their orientation, they run parallel to each other in a, that's just it. All right, they run in a parallel direction. And the example are the muscle you see on your lumbar region, that's the quadratus lumborum. All right, then you also have the thyroid muscles, which was not shown in those slides. Okay, those ones are example of parallel orientation. In this case, this is quadrilateral, hence the word quadratus. Eh? It's just the thyroid that is not named according to this group here. And then you have the long. See, you don't get it confused if you see this in your MCQ question. Okay. Uh-huh. Then if you see the you have if you look at the sartorius, it belongs to the long and strap-like group. Okay, and we say it's the longest muscle. It still applies the same, that they are fibers eh, run in a parallel direction, eh, like in the direction of the muscle pull, where the pull eh, the force of the pull is coming from. That's how the um, fibers running. That's in just that direction. Okay, so you have the sartorius, which is also known as the tailor muscle, and then you have the strap like, just like as the sartorius, but in this case with tendinous insertion, and the only muscle you have there is what, the rectus abdominis. Then for the fusiform, you have the bicep brachii, all right, which you've seen. All right, now pennate, the word pennate can mean like a feather like eh? Pannate means what? Feather-like. And we can further classify it into uni, one, or bi. But when it is more than two, from three above is called multipannate, like you see in deltoid. And then the tibialis anterior is circumpannate. You would see that on your, I think, okay, let's see if there's, I may go back again to show you the tibialis anterior, all right? But you will definitely see that it's closely related to the tibialis bone, all right? And then again, we'll look at still on this parallel orientation. We have those that have this spiral pattern, spiral form, like a spiral, like seen in the supinator muscles. Okay, the supinator is one of the muscles you found on the most uh, medial aspect of the forearm, all right, that forms a boundary in the cubital fossa, which we would not be looking at in this lecture. But clearly, we've talked about the sternocleidomastoid very well. We only mentioned the masseter. But you can see, like a cross, a cruciate, okay? Like a crossing, okay? Um, if we go ahead with the classification, we talked about uh, by the type of skeletal fibers. Histology will talk more on this, but you just know that you have the type 1 and type 2 fibers. And then the type 1, eh, the type 2 can further be sub-classified into type 2A and type 2B. All right. The type 1 is the fast, I mean, type 1 is slow fibers, okay? Those ones are not really, they carry out their activities based on what? Oxidative respiration. So you see the cells, you see a lot of mitochondria more when compared to what? The type 2, all right? And not all the type 2. But for type 2, you have the fast, eh? You have the type 2A and type 2B, all right? And the type 2A, I think we also have relatively more of this mitochondria than the type 2B, but they are both fast muscles, okay? They are both fast muscle. So we can look at that. Maybe when we look at it in histology, we'll talk more on that. Then we'll talk about their insertion. When the muscle is inserted close to a joint, it's called what? It's called the sprott muscle. And when it is inserted far away from the joint, it's called what? The shunt muscle. All right. Now let us look at the naming of these muscles. How do we name this muscle? We can name the muscles by their either by their shape, the size, or the number of head. We will talk about pectoralis major and minor muscles, okay? They are relative muscles, okay? But one is bigger than the other. You see, size. Then um, um, adductor longus and adductor brevis. Brevis refers to what is the opposite of long, which is short. All right, and then by their shape, deltoid like a delta shape, and then the quadratus, just as seen in the this quadratus, like this muscle that we use the example, quadrilateral. We have the quadratus lumborum. All right, so that's just it. The shape quadrilateral. Then the muscles that have the rhomboid shape is the rhomboid. You have rhomboid major, you have rhomboid minor. So this rhomboid is by their shape and will also fit into size. Okay, so it combines both shape and size. Rhomboid is shape, the major is larger, the minor is what, smaller, like we said earlier on. You have the lumbricals, you find them on the palm. All right, you find them on, these are the muscles that are inserted on the palm. All right, the um okay, we wouldn't talk about it. Then if you come to talk about the numbers of their head, we've also see the quadricep is 4 heads. Okay, we name them, which are the rectus femoris, vastus intermedius, lateralis, and medialis. Okay, then you also have the bicep, 2 heads, tricep, okay, 3 head. Digastric is also 2 head. But see here, let me show you. This thing looks more like the digastric muscle. It has both anterior and posterior belly. All right. This is just how the digastric is. It's different from this. It's different from this. The bicep 2 head. They are also 2 head, but this one has the anterior belly. It has the posterior belly, and it's crossed around a string, a sling. Okay. So that's this. That's that rather. Still on this, we'll come to look at the position. Okay, when a muscle is when two muscles like the supra and infraspinatus, one is inferior to the other and the other one is superior, so we use the word supra and infra. Example you see is the supraspinatus. Okay, is by their position. The abdominis muscles, the rectus abdominis, I mean um the external oblique, internal oblique. Okay, they actually they'll fall into the depth rather. The external and internal oblique will fall under the depth. Okay, all right. This, don't be confused, this refers to digitorum. So you have flexor digitorum superficialis and flexor digitorum profundus. The profundus is deeper, hence we look at the depth. eh for depth you have deeper is profundus and superficialis is what external, more like closer to the skin, while this is deeper than the skin. Okay, that's just it. um you see, we name muscle by their attachment. Okay, sternocleidomastoid, there are three attachments and it is named according to that. Sternum, the sternal end, that's the sternal head. And then the clavicular head, those two, like I just illustrated earlier on, they will go on to insert distally at the what? The mastoid process, coracobrachialis, coracoid process of the scapula, all right? And then to the forearm, I mean to the arm, that's the humerus. So it's named coracobrachialis. So you see the bone, all right? And then you can also name by their action. The flexor muscles, they will flex the joint. And when you say flexion, like we described in our introductory lecture, we say flexion is inflection movement. The resultant angle, like the angle of the between the joints, between the two joints will what be reduced. It becomes what, acute, all right. While the extensor, we use the word if you use the word obtuse, like it will increase the angle between the joints. Okay, And for the adductor and abductor, we talked about that. The abductor is moving away from what? Moving the hand away from the median plane, okay? You're abducting. Then adductor is bringing it back. So by these are actions and muscles are named according to that. We have the adductor longus, adductor brevis. You see, actions. So the adductor longus and adductor brevis will fit into what? Size, okay? Will fit into what? Size. um And we also correspond to what? To action. So these things, when you go back, you actually you can revisit this video and actually check, um and try to comprehend this thing. Then you can also go back to your test material. I'll make this slide available for you. All right. Then if we talk about we'll actually talk about it in histology. All right. We'll talk about it in histology: endomysium, perimysium, and epimysium. Okay. And then we'll look at what the as the fascia that is outside what the epimysium. There is fascia on the outside of the epimysium is fascia is on the outside of the epimysium. So those fascia is not seen here. It will wrap the muscle. Okay. Um, well, it blends with the connective tissue or blends into the connective tissue attachment. All right. So you see there are tendon-like structures. There are like aponeurosis. They have the aponeurosis and so on and so forth. All right. Um, okay. I don't need to talk about this. I think we've mentioned this in function, produce movement, maintain posture. Also, it stabilizes joint and generates heat. You can see that. All right. Um, Again, I said anything pertaining the histology, I would not talk about it unless we are in the histology section. All right. But these are for skeletal muscle. You can read it though. You can look it up. All right. So for now, I think we are through with the uh, gross anatomy. Okay. Muscle response to strong stimuli. Either muscle force depends upon what the number of fibers stimulated. So if all the muscle fibers is stimulated, you have greater force than when few of these fibers are stimulated. And we will say the contraction could result in what? In generation of heat or tension. Okay. Generation of can generate movement or maintain tension. All right. Or the tone of the muscle rather. Okay. Now, one basic difference you find between skeletal muscle, smooth muscle, and cardiac muscle is the fact that for the skeletal muscle, they are easily fatigued. Cardiac muscle is not fatigued. Cannot be fatigued. The smooth muscles cannot be fatigued. So on that part, you see that you can actually see a clear difference. But maybe when we look at the histology, we also talk about some other differences because we look at these differences in their histology too as well. All right. So yeah, okay, you can see a fixed part and then a moving part. So the mobile part is referred to as what? The insertion. So why the fixed part describe what? The fixed part describe the what? The origin and attachment. Okay. All right. So the origin is attachment of muscle to the what? Immovable bone. While the insertion is what? Attachment of to and what? To a movable bone. So this is illustrative a lot. The fixed part and the mobile part. So this muscle here that will flex this joint, eh? The fixed part is this. If we say this is the femur, all right, we'll call this the humerus, all right, and then you see this muscle coming from this part of the humerus. Let's say it's the brachioradialis. Let's say it's the flexor Tapion Harris as an assumption, you can see that this part is the movable part, and when it contracts, there will be change in the what muscle geometry, and when it changes, it shortens. The length will shorten, and the part that will move the joint is this one. So we call it what the for a better still, the word proximal and distal attachment are better used. So the distal attachment, the distal attachment is the more movable part, while the proximal attachment is the less movable part. All right. So these are just that. You can see these are some of the examples. Just don't scroll past it. Appreciate it. All right. So again, if we look at types of contraction, we can basically classify into isotonic contraction and isometric contraction. Eh? And the isometric can further be classified into concentric and eccentric type of contraction. All right. All right. The in isometric, in isotonic, basically the contraction is just to what? Is just to what? Maintain what? Maintain the muscle tone. Okay. Maintain muscle tone. While the isometric contraction will do what? Maintain the muscle tension or increase the muscle tension. All right. Sorry, I was talking about the isotonic. Just correct that. The isotonic was concentric and eccentric. Okay. In the concentric, muscle shortens and work is done. While in the eccentric, muscle generate what? Force as it lengthens. Okay. That's just it. But the isometric contraction is building up what tension. Okay. In that case, the length of the geometry of the muscles will not be changed. All right, even despite the contraction. So the sole aim of that contraction is to maintain what muscle posture. Please, it's just a slip of tongue. So I believe that you've taken that correction. All right. So when the muscle is relaxed, it doesn't mean that the entire muscle fibers are relaxed completely. Okay. And sometimes it's not even all the fibers that contract simultaneously. All right. So sometimes we say the force of the force of pull of that muscle will depend on the number of muscle fibers that contract. More pulls when all the fibers are contracted, and less force when some of the fibers are not contracted. All right. So these are the effects. Okay. The muscle will increase as hypertrophy. These are you can look at this in changes, adaptation of cell to various stimuli. Okay, and of course, when it's done, exercise strength is build up. Okay, and then the muscle efficiency, but the muscle will become even more fatigue. I'm sorry, more resistant fatigue because of it's a form of adaptation. Unlike when the muscle is not being exercised regularly, it can easily become what? Fatigue. So these are movements. We've talked about this one, okay? We've talked about this in our introducing lectures. Then there are also prime mover antagonists, and you will read these ones up, all right? I don't need to talk about this. Again, like I said, I wouldn't look at the histology, but they are just talking about the histology. We've mentioned the smooth muscles, okay? You find basically the smooth muscle. When we talk details, we will know whether we want to use the classification of just smooth muscle and skeletal muscle, or we want to look at skeletal muscle with like we have the visceral skeletal muscle and somatic like this, just purely skeletal muscle. We will not be using word skeletal muscle. We'll use the word striated and unstriated muscle, and then we have the visceral striated and the somatic striated or skeletal muscles. Okay, so those are just that. I believe we'll spend too much time uh, on this. On this part, but that's just the cardiac muscle. Okay, I go say they maintain their own cardiac, they maintain their own pace. All right, you can read this up. All right, no, we're not looking at this. You can also read up all this. All right, just hold on briefly. Let me just take this call. Hello, yeah, yeah. I just have to take this. Just an emergency that I have to attend to. But I'm done with it. Let's get back to the class. All right. So this, if the slide, you may just practice of course, irritability is not part of what characterizes muscle. You know that, okay. You will definitely know more of this. Look at the histology. Then this one, you would, I think you should know this answer here. All right. So I don't need to mention. Just answer it for yourself briefly. Can you type this answer in the comment section? Let me see what you will give me as answer. I'm looking at it. Can you type the answer in the comment section? If you have been in this class since and if you have been, who is Chetachi? Chetachi, hello. I'm not getting any response from you guys. No response at all. Are we still together? Or I'm all alone? All right, like I said, type the answer in the comment section. All right. You can also type this answer. You just see if you have been following up. It's just to show if you have been following up with the lecture. All right. It's just to show that you have been following up with the lectures. It could also be possible that you see this thing in your exam if you are doing MCQ word for word, unchanged. All right. So, but basically, you see, you just test what we've been saying since so far. And then look at this. The muscle, the dash muscle is a deep lateral muscles of the forearm that flexes the thumb. Okay, the thumb joint and assists what in grasping. Well, for you, you may not, we didn't mention policies. The thumb refer to what policies. So basically, you can see that that is the answer. All right. If you know it, that means you must have read it before. Then this, I will leave this one for you to answer. You maybe expect the adductor group of muscle, but unfortunately, they are not the adductor group of muscle. You have a tensor facial lata, you have the iliacus, you have the gluteus medius. All right. But if you look at it, the iliacus is what part of the adductor group of muscles. All right. you may want to give it to it. I believe you should know this answer because the rectus femoris eh, is part of the my throat is what sorry, I've talked too much. And then you have the tender muscles and the hypothalamus muscles. All right, they are actually located in. Okay, I'll leave this one maybe when you study. Okay, let me just leave this answer for you. Let me see what you are typing on the comment section. Okay, I'm just answering it as we go by. Eh? So this one, the simple thing is the palm of the hand. You have the tana muscles and the apotana muscles. Let me show you my palm. Let me show you my palm, and you can see this. This is the tana muscles. This is the hypothalamus muscles. The tana muscles is on the radial side. The prominence, the group of muscles that make that prominence on the radial side of the arm, okay, is the tena muscles, while the one on the ulnar side, ulnar arm, is what? The hypotenal muscles. All right. So that's just that. So eventually you will see it is in the hand. It's not in the forearm. It's not in the foot. It's not in the leg. All right. Now let's look at. I think I need to take it a little bit faster. We have the axilla, all right, and the pectoral region. There's really nothing much. I think everything is well stated, so I don't think I have anything to tell you much about here. All right. We've talked about this. All right. Another word for axilla is what? Armpits. I think we also talked about it in our introductory class. And then these muscles are the muscles that are found in the pectoral region. Okay. Okay. The muscles that are found in the pectoral region. So the muscles you have in the pectoral region, if you look at the one that is inserted, that is around the clavicle, is the subclavius. If you look at the ones that are in the scapula, on the posterior side, you have the subscapularis, and then that is the subscapularis. Basically, you find it on the coastal surface of the what scapula. And then other muscles you see or you find include the what do you call this muscle? You have the serratus anterior. You have the you also have the supraspinatus, infraspinatus, okay, and then you have the. Let me see if those things are listed here. Okay, you have the supraspinatus, infraspinatus, okay. Uh, okay, those muscles are not listed here. They just talk briefly on some of the muscles like pectoralis major, subclavius and minors, and pectoralis minor. So I'm just listing those muscles, okay, for you. You also have the quadratus, no, not sorry. You have the rhomboid major and minor. You also have um the deltoid muscle on the lateral side. All right, it has both the external end and clavicular end. Okay, then you have other muscles like bicep, triceps. These are sorry, bicep is not pectoral. Tricep is not pectoral. They are muscles of the arm. You also have we've talked about the serratus anterior, subclavius, okay. Then we've talked about the trapezius, and then those are the muscles of the rhomboid major, rhomboid minor. All right. And muscles, so we can further classify it into the direct and indirect. Those that are attached to either the clavicle or scapula at the direct group, while the ones that don't have any direct attachment, and neither attached to the clavicle or the scapula, but they move the muscle, the pectoral region also, the forearm. All right, they move the arm rather. Example include what? The upper limb muscle. They include the latissimus dorsi is one. Then you have the um, which other muscles do we put in this group? You have the teres major and teres minor. I mean, rather, you have the pectoralis major and pectoralis minor, right? So the pectoralis major will not belong to the. You may not want to class. Okay, the pectoralis minor is classically one of the muscles that the direct muscle. All right, so let's look at the axilla. Again, the axilla will say is the armpit, and you can see the shape. Eh? Right? And definitely the boundaries, okay, will also be stated. Eh? We'll look at the boundaries will be listed here. But again, you want to know what you find under the armpit. You have the lymphatics, you have the blood vessels, okay, and then fascias as well as nerve, okay. And you definitely appreciate that the brachial plexus, eh, they have the cord of the brachial plexus in the axilla. It's from there they give up their branches. All right. So the muscles, the vessels are clearly illustrated here. All right. So they serve as a conduit. They serve as a conduit between what structures that passes from the trunk and the neck, going to the upper extremities will pass through the axilla. So you may want to see it as a junction point for these vessels like neurovascular bundles, basically. All right, which include the lymphatics, the blood vessels, okay, the nerves. Then the fascia will also will play a role in maintaining what the um, the shape of the axilla. All right. So I wouldn't bother about these boundaries; they are written here. All right. But the cervical axillary canal, let us see a picture. Anteriorly is bounded by what? The clavicle. Okay. Medially, you have the what? Lateral border of the first rib. Okay. And then that is medially. Laterally, you have the what? Um, you have the head of the humerus. Okay. Posteriorly, you have the coracoid process. All right. That's the scapula. All right. Those are the boundaries that will make up what the cervical axillary canal. All right. In front of the clavicle, behind what the upper border of the scapula, and then medially you have the outer border of what the first rib. All right. Then laterally you have the head of the what humerus. Okay. So these are the boundaries of the axilla. I will leave it up. A bit. In fact, seriously, I'm tired. I talked for significant length of time. I was actually thinking that we can go ahead to talk about uh, uh, I was thinking that we can go ahead to look at one more thing because three things are highlighted. But I think for now, I actually wanted to talk about the anterior abdominal wall, muscles of the anterior abdominal wall. But because of my tiredness, I wouldn't be able to talk about it. But this is the triangular and quadrangular space we are talking about. You have the quadrangular space. You see the surgical neck. Note, this is the surgical neck of the humerus, okay? It forms the lateral boundary of the quadrangular space. And then Medially, you have the long head, tendon of the long head of what? Triceps. And then the superior boundary is formed by what? The teres minor, which is this. And then you have the teres major. Okay, you have the teres major forming the inferior boundary. Okay, structures that are passing from the axilla to the upper extremities. Once they get into the lower border of the teres major, it will change its name from axillary to what? Brachial. All right, that is just it. And you have the upper triangular space or media. Now you have the long head of tricep. This time we form the lateral boundary to both the upper triangular space and the lower triangular space, or what is called the triangular interval. All right. Sorry, it will form rather the tricep, long head of tricep will form the lateral boundary of the upper triangular space, the medial boundary of the lower triangular space or triangular interval. All right. The humerus forms the lateral boundary, in this case for the triangular interval or lower triangular space. Now let's look at it. If we ignore the surgical neck and say the humerus generally, the humerus forms what? The lateral boundary of the lower triangular space and quadrangular space. But if you want to talk about the lateral boundary for the quadrangular space, you have to be specific about the surgical neck. All right. That is what differentiates it from the lateral boundary for the lower triangular space or triangular interval. I keep mentioning the both in case if you see lower, don't get it confused. All right. The structures that passes through it are actually listed. Here you have the axillary nerve and posterior circumflex femoral artery. Here you have the radial nerve and then the profunda brachial or deep, like if you remember the word deep brachial artery, okay, they will pass to the posterior compartment. They will pass here to enter the posterior compartment of what? The arm. All right, that is just it. Why some will pass here to go to the what? The supply the coastal this thing, okay, circumflex scapular artery. So the boundaries are actually listed. Okay, the boundaries are listed here. We've talked about it. All right, we've mentioned it. So you look at it, read what is written there. All right. So again, fascia, skin, and clavipectoral fascia, they all form the floor of the axilla. So look at the axilla, the content: artery, vein. My battery is even running low. Artery, vein, brachial plexus, and the axillary lymph nodes. Then you can also see the axillary space of Spence. My battery is running low, so we cannot continue. All odds against me. So please, um, um, I will call this class to an end. I just hope that for the part that we've been discussing, I've been talking about since, you guys were actually understanding. I'll gladly let you know that please, if at any point you are not following up with my lectures, I am with you. We are friends rather than just being a lecturer. We could see anywhere. So I would appreciate it more if you can come to me and say, sir, can you explain to me this is a bit difficult, or give me insight into this and that. I'm there for you. All right. At least it will help you to pass your exam. At this point, let's call the class to an end before my